Yeah, well, so again, in a collaborative practice, it's very important that we are all on a similar page, if you will, following the same evidence, giving the patients the same message. And the best way and the most efficient way to do that is with our weekly high-risk obstetric meeting, where
it's early in the morning.
It is early. It is early in the morning, but that's what we have to do. And we discuss them, and their management and what their risk factors are and what their plan should be, and who needs specialty referrals, and it's critical, and it really changes women's outcomes.
It's also a good time period to discuss any updated management that comes through our organizations as far as what's changed for
research,
for guidelines and research. And
research changes all
new
the time.
things, and if you want to take your placenta home.
Yeah, right. We don't have too many of those.
I know, right?
We had a lot in Oregon.
Yeah, we did. We used to have a lot.
I'm like, whatever you want to do.
That's right.
I mean, whatever. Sounds good.
Well, and I tell patients, even if you are higher risk, but you've never seen me, we've talked about you. That's how we talk about you.
Yeah,
Yeah,
it's true.
We talk as a group.
We talk about you behind your back.
We do. I tell them we talk about you.
In a good way.
Yeah,
In a good way.
Put together plans for
Absolutely.
you.
And I try to tell patients that when they're high risk, that they may meet you guys at the hospital, but we have been discussing them every
Right.
Monday.
Absolutely.
So everyone's on the same page
Absolutely.
as to what the plan of care is.
Also helps streamline that referral to maternal fetal medicine, which we all know is we don't have in the area, so that helps to get that streamlined, and then we all remain on the same page.
Well, and although I don't see patients in the office anymore, even in the hospital, I may have essentially a clinic patient who gets evaluated, examined, some labs ordered and sent home, and et cetera, et cetera. And I know everybody at this table too, because we're in this group together, I welcome somebody looking over my shoulder. Did I overlook something? Did I pick the best antibiotic? What was the result of this test? And I welcome that, because I can't know everything all the time. I can't keep up with every new data and research and how things are changing. I do my best, but just the other day you mentioned a new hypertension guidelines. I'm like, I haven't seen that yet, but I'll find it. And that's the kind of thing that, again, a collaborative practice benefits women, because there's a checks and balance.
Right.
As much as we all want to be perfect, none of us are, and that checks and balance is critical.
I like to see whenever somebody comes to see me on a Monday or Tuesday, and they say, I've been at the hospital over the weekend, and I can count on when I go to the OB episode, there's a note from one of you guys.
Absolutely.
Putting
That's
the details
different
of
too,
the
because
visit.
in the past, if maybe another provider saw one of our patients on a weekend, those systems don't correlate.
You had no idea.
But now, you guys are seeing patients, you can look at our office system and the hospital system.
Absolutely.
And so you're not trying to wing it and figure out what the patient's talking about. You can actually go see their visit in the
Exactly
office
what
and
happened.
see results.
Yep. Yep.
That's
Helps
been
so
very
much.
nice.
Yeah.
It's important.
And that carries
Yes.
through the whole week, because Dr. Gibbons and I are also seeing patients and splitting that call time. So our patients are essentially seen by a Missouri Highlands provider 365 days a year,
Yeah.
which is nice.
Absolutely.
So there's no
With
change
access
over
to the chart.
that. Correct. And access to you, Jody, you and Sonia, through the call service too, which you guys carry
Absolutely.
all the time.
Yeah, then we have that,
Thank goodness.
that evening and weekend answering service.
That's right.
Yeah.
For emergencies.
One of our bright, shining voices. No, that's nice. So there is continuity. Now, maybe you had a patient who was having a little bit of an issue, not sure which direction it might go, and they leave, and you know that if they have a problem that evening or the next day, they're still going to be in our system.
Yes.
And then we've talked
Contact.
about it.
Yep.
It's been discussed. Yeah, I'm usually really excited for Monday morning, because it's fun and we get to sit and discuss that stuff and then visit a little bit, and being in solo practice is quite lonely actually. So it's fun.
Yeah.
It's nice.
Been there. Been there, done that.
It's kind of weird. It was us for so long. and
Yes.
Now it's all of us.
I
but
know.
It's fun. It
Divide
is.
and conquer.
That's
Yes.
right.
Divide and conquer. As a team.
We have yet to have dinner together though. that.
We have not. Who's going to be on call?
I don't know. I don't think Michael will want to do that. Yeah.
Somebody's gonna have to be on call.
Yeah.
I know. Yeah. Well, I don't know about you all, but I'm excited to see what develops further from this.
I'm excited. I'm
Hopefully-
excited about our vision.
I am
I
too.
absolutely.
Yeah. I hope our patients are.
Yeah.
Well, we're getting a lot of feedback already
Yes.
from patients who are being seen and delivered by you guys, and they're just ecstatic. They really like both of you. So
Now, I'm
that's
not gonna
nice.
lie. It's hard. It's
Yeah.
hard as a solo practitioner to transition that because I'm like, well, I want my patients to like me.
Yeah.
and then I'm like,
And they do.
And then I'm
And
like,
they
you chose
do.
this
Yeah.
path for
And
their
they do.
benefit, and they do, right?
And they
So
do.
it's funny because when you ask somebody, do you want to be induced? They want to be induced. Do you want to be induced on first available? Do you want to wait on me? And they're usually like first available, please. And, and I'm like, what? And then I'm like, absolutely. Okay, you're gonna love who you're gonna see that day because I trust you all. I trust everybody at this table to provide the same care that I would provide whenever I am not here.
So
So absolutely.
So
Yeah,
important.
those patients are important to us. So
I think they all win with a big group like this.
I think so too.
They're all winning.
Yeah. I
We
think
are
it's,
too.
So
it's
are
a
we.
good size.
We are winning, they are winning.